Hello, this is Paula Anderson with Paula Anderson Coaching and Consulting, and I'm getting ready to start a series of videos on medical coding. So this video today is going to focus on evaluation and management coding, and we're going to cover the basics. Now, I started offering some complimentary medical coding courses to just kind of see what the knowledge base is for individuals, and then to determine what the need is for individuals that are trying to pursue their medical coding certification. So I will be offering these videos once a month. So tune in to my YouTube channel, which is Paula Anderson Coaching and Consulting LLC. That's Paula Anderson Coaching and Consulting LLC. Also, you can go to my website at paulaandersononline.net. That's paulaandersononline.net. And you can learn more about what I offer. So let's get started with this video. So evaluation management is a specialty that I coded when I was working as a direct medical coder. Now, it is a specialty that I enjoyed coding because it allowed me to look at the clinical notes as well as the office notes and determine what the level of E&M code was for that particular service. So when we talk about evaluation management basics, I want you to get your CPT manual and turn to the very first section of the manual, which is E&M. So you have the section broken down based off of categories, and then you have subcategories. So your categories are going to be such as your office or other outpatient services, your hospital inpatient observation care services, consultations, emergency department services, and critical care services. So one of the things that you want to be able to do is you want to understand where the patient is being treated. So that's going to make the determination as to what category that you're going to be using. So we're just going to focus on a few of the categories for this video. And if you have questions, then of course you can send me an email. And my email address is paula@paulaandersononline.net. That's paula@paulaandersononline.net. Now, when we talk about your subcategories, so that's going to be whether or not it can be coded based off of the patient being new or established. So think about your office or outpatient services. So you have a category of new, and then you also have established. So of course, a new patient is someone that has not been seen within the 3-year period. And then your established patients that have been seen within that 3-year period. Now, you do have some specific guidelines as relates to whether or not the patient is considered to be new if it's within a multi-specialty group practice. So those guidelines are in your CPT manual. So established patient, of course, like I said, has been seen within 3 years. And then you have to determine whether or not the patient is outpatient or inpatient. So outpatient consists of if they're in a clinic office setting or if they're located in a hospital setting where the area that they're in is designated as an outpatient center. So you want to understand exactly what type of patient they are and then what the location is. Now, inpatient is going to be they have been admitted into a hospital. So that's going to be beyond the 24-hour period that they've been in the hospital. Now, in 2021, the American Medical Association, they revised the E&M guidelines. And then in 2023, they finalized the guidelines. So this presentation just kind of focuses on what some of those changes are. Now, I am not providing any kind of medical coding advice with this video series. So if you have any questions about medical record documentation, you can set up a consultation with me so that I can actually review the documentation and then I can give guidance based off of that documentation. But I cannot answer questions without reviewing the medical record documentation. So you can code evaluation management services based off of 2 areas. So you have time, which is the time that the physician is spending with the patient to make a diagnosis. And then you have medical decision making. So let's talk about medical decision making. So there are 4 levels of medical decision making. You have straightforward, low complexity, high complexity, moderate complexity, and high complexity. So this is what I recommend. If you really want to understand how E&M codes are assigned, you want to think about the medical decision making. So what is the judgment that the physician is using in order to make a diagnosis? What type of data is he reviewing and analyzing to make a diagnosis? And then what are some of the problems that the patient may present with other comorbidities, okay, where that's going to be a risk of the patient in terms of whether or not they're going to live, or there are going to be some other complications that they may have. So those are like the three things that go into the medical decision making. So when you're coding E&M services for the purpose of taking a certification exam, you're looking for where the patient is located, meaning like what type of service is being performed. Is it an office visit? Is it a hospital visit? Is it an emergency room visit? Is it an observation care visit? Is it a newborn service? Are they receiving preventive medicine services? So those are going to be the things that you want to look for. Then you want to look for, are they new or established? So new, of course, they've not been seen before. Established, they are a recurring patient. Some of the other terminology that you will need to be thinking about is initial, which also means new, and then subsequent, that means new as well. So in your CPT manual, you should have a breakdown of your medical decision making. So that's going to be one area that you want to focus on. Now, time is another factor that can be used to build your E&M service. So you want to look under the CPT code description and see what the time element is. So because I have not coded any E&M services since the new guidelines have been established directly, I'm giving you the guidelines. All right. So if you want to learn a little bit more about the practical side of things, then I recommend that you reach out to a medical coder who actually is coding E&M services. All right. Now, when we think about time, of course, the time has to be documented. So you have to indicate the total amount of time that the patient is being seen by that physician in order for that to count as a valid E&M code. So let's talk about the CMS. Let's talk about the E&M modifiers. Let's talk about what are some of the modifiers that are used in order to assign for evaluation management. So there are actually 4 modifiers that pertain to evaluation management. So we have modifier 24, we have modifier 25, modifier 32, and modifier 57. So what I would like for you to do is I would like for you to get your CPT manual out, and I would like for you to look at modifier 24, and I want you to review over that modifier. And then what I'm going to do is I'm going to have a part 2 to this video so that you can learn a little bit more about the modifiers. So thank you so much for watching this video. My name is Paula Anderson with Paula Anderson Coaching and Consulting. I'm a certified medical coder. I've been a coder since 2002. I'm also an approved APC instructor. Thank you so much for watching.